Get started. Good afternoon, everyone. This is the last quarterly check-in meeting for the cancer plan revision. Thank you, everybody, again for being here. So our agenda today, we are going to talk about some updates to the editing process, the timeline, the final submission of the state cancer plan, the cancer plan website format that we've been working with our communications team on. We'll talk a little bit about the outline, also the cancer plan dissemination survey that's been sent out to all of you. And then next steps, what's next? You guys have been working with us for over a year and a half, and I know everyone wants to know what's next now. And then we'll have an open discussion because we'd love to hear back from all of you regarding this process, feedback, anything you want to share, we want to hear it. All right, so just to give just another just overview of our team here, myself, we have Sheila Sinyo Gerhardt, Joyce Para-Aiko Seha, and then Lindsay McDermott, who is our contract editor. And I'm so grateful to have her during this process. So here's a little update on the editing process here. On May 19th and 20th, the whole team met in Los Angeles to compile all of this content for the cancer plan. And you can see in the pictures in front of you here, that's all the content. Actually, that's not all the content. We had another wall that had more content. So we printed out all of the templates that you all had provided to us. And the purpose of this meeting was to really look comprehensively at all of the content, identify, again, duplication. There was a lot that went into it, and I'm going to welcome Lindsay to kind of go over some of our takeaways from that meeting. But it was a very productive meeting. And you could see that we had our intern, Brittany Chen, who's been helping with the data measures, who's done a fabulous job during this process. Thank you, Brittany, for all of your help, hard work during this process. And Brittany is staying with us. We're very, very happy. She actually is now working at another position, but decided to stay on with us. So we're grateful for that. And we even had our assistant deputy director of the Center for Healthy Communities within the department join us, Dr. Jessica Schumer, as well. So just amazing meeting. We got a lot done, obviously. And now I'm gonna, and then also, as you see on the slide, our meeting space was graciously sponsored by Cedars-Sinai Cancer. So those 2 days, they really provided the resources for us to be able to meet, because our program doesn't really have a lot of money. So we're grateful for that. And now I want to turn it over to Lindsay McDermott to kind of just talk a little bit more about that meeting and a couple of the things that came out of it.
Sounds good. It's good to see you all. Thank you so much for everything that you put into the plan. It was great to see it all in one place in person. We felt like it made sense to just all come together to look at it and see, okay, how is this flowing? How are the pieces connected? We also wanted to look at it from like the big vision perspective too of what story is this telling for addressing cancer in California. So because you all put together such amazing action steps, strategies, priorities. It was just so exciting to see it in one place. And so I wanted to share a couple actions that came out of that meeting since it relates to the work that's been put into this plan. So when we put it all up, it really showed this is a comprehensive plan. It's very thorough. There's just so much included in it, and it really shows how key partnerships have been to implementation. We looked at a couple different factors. We looked for things like duplication. We looked for things like consistency in language. There are a lot of pieces around advocating for different policies? And are we using similar language when we're talking about that so that it's easy to index those pieces for a potential, here's what a potential policy platform could look like. So I'm trying to be more consistent in language. There's different terms for how we refer to priority populations, or underserved populations, and how is that consistent throughout the plan? And kudos to, I know Sheila and Joyce really have been tracking in depth all of those connections. And so that's one piece of what we looked at. We also looked at, are there any gaps in the plan from in terms of emerging trends, et cetera, in cancer prevention and control. And there was a couple that we looked at. There was, we added some language around implementing evidence-based mindfulness, meditation, and social connectedness practices as a proactive strategy to reduce cancer risk. We also added some language around the link between the emerging link between diabetes and elevated cancer risk, and some actions around that. So those were a couple of the gaps that we had noticed, because when you're each working on a different piece of it, it's hard to see, okay, did we catch everything? And so it was helpful to just see it all in one place and be able to look at some of those pieces. The other thing we looked at was, okay, does this reflect a public health approach to addressing cancer in California? And since it is a comprehensive plan that covers the upstream prevention through treatment and survivorship, it does go beyond public health into healthcare. And we wanted to make sure that story was clear throughout the document and connected. And so Dr. Jessica Schumer, who's joined, was really good in articulating what that could look like. And so she suggested having two things, and you'll see one here on the screen. So having a logic model that shows how the different parts of the plans are connected to the outcome. So there's a draft up on the screen now. It will definitely be shown to you later in a bigger format. This is just more like a visual for something that we're working on for the plan that will be reviewed. And then the next slide is the You Are Here map. So when you're looking at the cancer plan, this is referring to, and Dr. Schumer, I'll open it up for you too to share to your perspective, but it's that like when you're in the mall and it's like, you are here. So this is here's where you find the different pieces of the plan. Here's how they're connected to the continuum of addressing cancer. We can see that health equity is across all the parts of cancer prevention and treatment and survivorship, and so is surveillance and data. And the plan really reflects that. And so we wanted to have a visual showing where you could find those different pieces of the plan in the different chapters. This is also in draft form that will be reviewed, but just wanted to show a little preview. And then Shantae will share a little bit more about the other feedback that we got, which was to create an executive summary that shows how, if we address health equity, if we address primary prevention, those will help significantly in the need to have treatment or early detection and screening. And so we developed an executive summary that helps like illuminate the life course approach of this continuum that we're emphasizing and why that's important. So I'm going to pause there and see if anyone else who was at that meeting has anything to add.
Hi, everybody. Just wanted to say hello. Happy Tuesday. My comments were really just inspired by the work that's already been done. And it was more about arranging it and kind of marketing it for ease of consumption and just thinking about who we want this to be useful for. And so if you go back one slide, I hadn't seen, this was hot off the presses. I hadn't seen that yet, but it looks beautiful. And this was work that already kind of existed, and they took it and freshened it up, which I think is great. And I think these are important for long-term sustainability and for preserving the wisdom of this group and the approach. And I think that's as important these days as any one point in time. Harnessing our best thinking is really how do we keep this to be a long-term document that can be sourced and understood over time. And so that was one of my approaches. And then like Lindsay said, in the next one is just trying to orient people to the pieces that might be most relevant to them in that moment, but also give them the breadth of the treasure trove and the breadth of information in this compendium, in this plan. And also we're just, and maybe you already mentioned this and I missed it, sorry if you did, was just how to harness large language models sourcing and searching to be able to help folks who might have a prompt that they put in, like, help me create a plan for X, Y, or Z, or what's the best way to do X, Y, or Z, that we know that this can be one of the source documents that it pulls from. And so if folks have ideas on that or they've started to explore that, please share. I think that would be a huge another addition to helping with the longevity, the sustainability, and making sure this permeates through all the spaces where people are thinking about this important topic. So just some other thoughts about where I was coming from, but really proud of what you all have done. And thank you to our team as well, who've been stewards of this journey.
Great, thank you. And I just wanted to acknowledge too, Shannon and Bridget, who contributed to the looking at the connections between the plan, and also just had, Shannon's shared about, federal impacts and how that impacts our shared work, and that the landscape of public health is shifting a lot right now. And what does that look like for moving forward in this plan and this work? And so it was, I think, so I know it's our hope that you feel part of a collaborative and part of a partnership in implementing this, that there are so many people doing really important work in this space, and getting creative in how to move it forward. And then and Bridget, I know Bridget was great too at like, hey, these strategies sound similar. Can we help merge them so that we can have a plan that flows well? And so it was just great to get that feedback. And I'm going to turn it to Shantae to show a couple more pieces of that. But thank you again for the great work that you put into this.
Awesome. Thank you, Lindsay. And thank you, Dr. Thumer. And also just thanks again to Lindsay for mentioning Shannon and Bridget's contribution, because they were there at the meeting. I was looking at our pictures, kind of calling everyone out, but I was going to mention your contributions as well. So thank you so much. So moving on, just as we're putting all of the pieces together, we always dedicate our cancer plan. We always have a dedication that's included to every cancer plan. And this year, there was some brainstorming that went on, and we'd like to dedicate the plan this year to those who have been affected by childhood cancer. And as this dedication opens, it does speak to all of those folks who have been dedicated or who have been affected by cancer. But we are, again, wanting a special emphasis for those who have been affected by childhood cancer. We're been very grateful and just, overwhelmed with a lot of just support and just strong passion from our childhood cancer committee, and those who have been leading a lot of the efforts, just not only for the state cancer plan, but for childhood cancer in California, and nationally for a lot of the advocates we're working with. So we're very grateful to all of those folks. And this was passed through our cancer plan advisory committee. So this is just a draft of the dedication that will be including in the cancer plan. And then, as Lindsay talked about, we did develop an executive summary as well. This executive summary is about 2.5 pages long. It also includes all of the measures, and it really gives just a nice, concise, easy to understand overview of what's in the plan. And so this is something that we're turning into leadership ahead of time. We're aiming for this week. We had a few more edits that we have to address, but yeah, the executive summary is coming together and is again just it's really well done. Okay, and now the timeline, like where are we at? We are again, hoping to submit by the end of June. That may fall back a week or two, but for the most part, we're still on time, which is awesome, especially for a long-term process like this. So you see now the plan is being compiled, edited, and we're again hoping to send through approval last week of June, first week of July, somewhere around then. And then, in terms of when the plan is going to be ready, that we can't really give a date on that because it's going to be going through the CDPH approval process, which we know takes a while. So, we're hoping for the end of December, but we will get it back when we get it back from the department, because there may be some back and forth on edits and things like that that we have to address, which is great because we do want this plan to be to represent, all of the things that we've included in here, and we want, we just want it to be right. So that's where we're at with our timeline. I'm happy with it. So, all right, and just a big thank you to all of you who have participated in this process. It's been like almost a year and a half. For those who have been a part of the executive committee, we started talking about this in March of 23. We started talking about it in March of 23. How long is this going to be? What are we going to include? Et cetera, et cetera. It's been a long time, a lot of, a lot of back and forth, a lot of contribution. And now we have this big, beautiful document that we're shaping. So, and I want to read this slide. A heartfelt thank you to all Cancer Plan Revision Subcommittee members and our Cancer Plan Advisory Committee members and our external contributors, those who may have not been on a committee, but who have contributed somehow to this process. Your dedication to this process is much appreciated and contributes to cancer prevention and control efforts that make a real difference in the lives of cancer patients and their families. We are deeply grateful for your partnership and commitment to making a positive impact. Thank you all. And on the next slide, we really wanted to acknowledge everyone who was a part of this process. So we've listed all of our Cancer Plan Advisory Committee members, all of the subcommittee members. And again, we just want to thank you all. You guys have, I mean, obviously we can't do this without you. We needed all of your expertise, all of your experience, and all of the emails, all of the back and forth, all of the, editing the templates here, contact this person. There's so much that goes into this that unless you're a part of it, you really don't know all of the different things. So again, we are very, very grateful to all of you. Thank you. And then we have another thank you slide, just kind of depicting some of the meetings and all of the things that went into it. Started out with, look at that, the cancer burden in California was our first webinar that we had to kind of inform the process with all of the data. That was back in November of 2023. So if you all can remember us sending stuff out, asking to join that webinar, and if you wanted to join the process, here's our cancer plan kickoff meeting, and then we went to the instructional webinar giving guidance, and of course the in-person meeting that we had in Los Angeles in June of 2024 that helped contribute to a lot of this content as well. So again, we are very, very grateful to all of you. Thank you. All right, so now what? Now what happens? Everybody does have a role. We are hoping that you will stay engaged with us because we're not finished. We are going to be waiting for the approval, but in the meantime, we may contact you for possible clarifications or additions regarding some of the content that was submitted. And we're also going to need your help with outreach, dissemination, and implementation. And one of those things that we're using to help with that is the CDOC Cancer Plan Dissemination What Can You Do survey. So if you are familiar with our plans, especially our current plan, we do have a portion in the back of the plan that says, what can you do? Like, what can you do with this cancer plan? What can you do if you're just a Californian? What can you do if you're a medical professional? What can you do if you're in education, right? So we're trying to, we want to still include this piece in the cancer plan, but we want to get your feedback based off of the content that you've developed on who the audience should be, who should we create these specific targeted user guides or implementation guides for folks who just, you know, are not going to go through the whole cancer plan, but want to know what they can do as in terms of, you know, where they work to help implement the cancer plan. And that survey, we'll drop the link in towards the end of this webinar, but you know, we really want your feedback on this because you all know the content well, and at least your piece. And we, again, want to get that feedback from you. And then lastly, just to know that you all will get a copy of this cancer plan, but it's going to be upon final approval of the content. So I just want to stress that we can't, you know, send out the cancer plan as is. Number one, it's still in draft mode, and as it goes through the CDPH process, because it will be a CDPH document, it has to have that final approval. So you know, historically, I get a lot of people emailing me saying, when is the cancer plan? When can I have it? When, you know, and just know that, you know, it will be coming, and we're going to be, you know, let you know about any updates that we can share. But you all will get your, get a copy when it's approved. And so as I talked about the cancer plan dissemination survey, what can you do? This is what it looks like. Give us your feedback, please. Sheila just dropped the link in the chat. So please complete that survey by the end of today. We did send it out a few days ago or last week. And we're hoping to gather that feedback to inform the last piece in the cancer plan before we submit it for approval. So if folks can get that filled out for us, if you haven't, that would be awesome. Thank you. All right, and before we open it up to hear your comments, we just wanted to give a couple of reminders for some upcoming events we have on June 18th, which is next Wednesday. We have our CDOC surveillance webinar. This webinar, I believe, is on cost per cancer case. Then we also have the California HPV Vaccination Roundtable Learning Collaborative coming up in July. So that's July 16th. You can register. Sheila's dropping all these links in the chat right now. And then coming soon will be our 2025 CDOC General Member Survey. Please help us with that one as well, because it helps inform our program evaluation. So we need your feedback on all these things. All right, so now we are going to open it up, and we again want to hear your thoughts. We want to hear from you. If you have anything you want to share, now is the time. You can raise your hand, Sheila, and you could take the slides down. I think we can see folks. So yeah, raise your hand or drop anything in the chat, anything that you want to share. Stacy, please.
Hey, Shantae and everyone. I just wanted to say this has been a very wonderful experience. I know that it's not over, and so I'm looking forward to everything that's happening. Just really excited about the plan. I'm excited because you're excited because you know that everything is scheduled, and looks very good. So I'm so excited about that. I just wanted to say to my team, thank you so much. Thank you from the bottom of my heart. It was a team effort. I know everyone on here, Haley, June, just everyone has been absolutely amazing. It's just been great. And yes, I'm a breast cancer survivor, and Laura, and just all of the team, all of the people that I got to meet, and including the staff here. So just thank you for the opportunity. I look forward to it coming out. I look forward to seeing it through and advocating and doing the outreach and all of those things. And thank you for this great opportunity. I think we all did an amazing job.
Thank you, Stacy. Bill.
I want to give a shout out to the interns who were very helpful in identifying some weaknesses in the data sources that we had initially thought would be good data sources for obesity prevalence statistics. And through their work, they definitely improved the quality of our measures.
Yes, definitely. Thank you, Bill. And I see some comments in the chat here. Thank you, everyone. Thank you for those comments.
Can I also just say out loud instead of on chat that your ability, the whole staff and the volunteers, the ability to navigate through such challenging times has been inspirational. So thank you.
And to piggyback off of that, I also just want to say that in the middle of all of these challenging times, the meetings about the cancer plan have been something that still is addressing and welcoming conversations around health equity and LGBTQ plus communities in ways that these conversations have been shut down in so many other arenas and so many other places that I operate in. And it's definitely been these meetings and this process and watching this plan come together, especially in the last few months, has just been such an anchor for me. And on top of that, I mean, just absolutely, Shantae, you and your team have managed through all of this with such amazing grace. And you have so many different personalities and people that you are working with and rounding all of us up and making sure that we're getting things to you, not too far beyond the deadlines that we're asked to get them to you, because I feel like we can all acknowledge that we don't meet deadlines. And y'all have just rolled with everything that we have thrown at you and asked of you and participated in with you through this entire event. So thank you. And also just a huge shout out and thank you to everyone who's been a part of this. We really are the front line of keeping health equity centered in the cancer care continuum conversation. And I just thank you so much.
I love what you just said, Shannon. I think a big experience I had, even though I've done a few plans in the past, this one was amazing because we were able to coordinate with another subcommittee, meet those other members and come together, right? And share one another's like strategies and activities and making sort of a bigger presence. I think health equity is so, I always call it kind of squishy, right? It's very hard to define. It's different than cancer prevention and so forth in the bigger sense. So I really appreciate meeting you, Shannon. You introduced us to some new language that we were not familiar with, that we did want to incorporate. So I think we did an amazing job. I do want to thank the CDOC team. Your coordination was amazing, right? You need that. You need the admin support. You need more than, Shantae Davis behind the scenes doing all this work. So I think that's what sort of kept me motivated throughout the whole process. But contributing with my team, my original team with Laura and Stacy, and learning how to work with each other, right? I mean, that was a big thing, I think. So the respect that we had for each other. I'm totally looking forward to staying connected. Maybe some like you all are moving on beyond our roles, given the administration's, given the federal cutbacks. So I'll be leaving CDOC, or excuse me, CDPH at the end of the month, but still working in cancer prevention. And so everybody has my Gmail account too, so to stay in touch. But thank you. Thank you all and all the committee members.
Thank you, June. All right, and I see some more comments in the chat. Thank you so much, everyone. Thank you. Any other comments? Anyone wants to come off of mute?
And then Shante, Christine has a question on the chat regarding meetings, recurring meetings for subcommittee. Subcommittee meetings are no longer happening, but CDOC team will be emailing you for any follow-up or clarifications. As you've seen, Christine, I've emailed any follow-ups with regards to your section. Thank you for getting that to us.
Yes, and yeah, I do see a couple of meetings, like Ernesto, I still see your meeting on my calendar. So if you have any meetings for Cancer Plan, you can go ahead and delete those. And yeah, we're definitely staying in touch with you all, because we, of course, want your help, like I said, with outreach, implementation, and dissemination. So it's not over, but the biggest piece is over. And I also just want to give a big thank you to the leads of all of these groups, because we had a lot of people who were involved in this process, but we did need folks at the lead of each subcommittee to help us, coordinate with everyone. And there were some folks who really stepped up and did a lot of work to help just, coordinate the team and help us organize everything. So we really truly appreciate your help, because we were communicating with you a lot more than some of the other folks, but you all stepped up and graciously offered your support, and we're very appreciative of that. I also want to thank Lindsay, who came in as a contractor, but felt, just part of our team and just really added so much to the process. And then also to Jessica Schumer, who came in and has had so many wonderful ideas that we didn't even think about, and started to incorporate a lot of those things. And I know we'll still be working together as it goes through approval on this, but you've been just a welcoming voice to this process that has really, uplifted it. And then, of course, to my team that I work with every single day. We're on the phone with each other every day talking about cancer plan stuff. And for those of you, just FYI, we at one point had cancer plan meetings every single day, looking at this content for probably over a month. And we met weekly with Lindsay. But again, just a really big shout out to Joyce Seha, who actually couldn't be with us today because she's on a CDC call that we had scheduled at the same time. And then also to Sheila Senyo, who really has been the lead in helping us to organize all of this content. And if you can imagine, Sheila, do you want to just tell us how many templates we've had and give some numbers on objectives, strategies, action steps, template, I don't know, whatever you have, because it's impressive. And I just want to make sure folks know how much you've done, because I couldn't even, I could tell you, I wouldn't even be able to go back and locate all of the different things that Sheila has organized. So
There's about 20 templates with just give or take 6 strategies each, and then 10 action steps for each strategy. So if you could only imagine.
yeah, it's a lot. So I thought you had done the math. We'll do the math one day.
No, I did not do that.
Anyway, again, thank you all for this process. Thank you for being involved in this process. We'll be in touch. And if there's any questions in the meantime, feel free to reach out to me, to our team, and we're happy to get anything answered for you. Thank you for attending, everyone.
Thank
Have a good
you.
rest of your afternoon.
Take good care, everyone.
Thank you all. Amazing.
Thanks, everyone.
Fabulous.
Bye.
Thank you. Bye.
Thank you, everyone.